Hello, good morning, everyone, and welcome to today's webinar. Hello, can you hear me?
Yes.
Yes,
Go
we
ahead.
can.
Oh, great. All right. So, good morning, everyone, and welcome to today's webinar. Please confirm if you can see my screen.
Still coming up.
Is it better now? Is it up?
Yes, we can.
Okay, so welcome to today's webinar. Today we'll be talking about to commemorate the Patient Safety Day 2024. We'll be talking about improving diagnosis for patient safety, get it right, make it safe. As a way of introduction, I will just give like an agenda of what today is going to be like and then some of the ground rules. I'll be introducing, we'll be having 4 presentations, one for each speaker. Presentation 1 will be on the impact of poor diagnosis on patient safety by Dr. Ifunanya Ilodibe. We would have a question and answer section afterwards, and the next speaker will be talking about AI as a guardian, mitigating ECG interpretation errors for improved patient outcome, and that will be by Miguel Alices. The third presentation will be on the role of accurate laboratory testing in accurate diagnosis by Dr. Afolabi Obe. We would also have a question and answer session after that. And the fourth speaker will be talking on enhancing radiological diagnosis, a crucial step towards patient safety by Dr. George Uduku. We would also have a question and answer session after that, and then a general Q&A session and feedback, and then we can conclude. Introducing the first speaker of the day. Okay, first, there are ground rules. We'll be having 30 minutes for each presentation, after which we would have our question and answer sessions. We would take 2 voice or audio questions. Other questions should be typed in the chat box, and then we'll take them as we continue. The webinar recordings will be made available on the EHA Clinics YouTube channel. That is EHA Clinics Official. So now it's time to introduce our first speaker of the day, Dr. Ifunanya Ilodibe, who is the Chief Medical Officer for EHA Clinics. Dr. Ifunanya Ilodibe is an accomplished physician leader. He's an accomplished physician leader, healthcare operations and quality management professional with over 14 years of experience. Dr. Ilodibe has emerged as a trusted leader, clinical practice, and patient safety advocate. In her current role as Chief Medical Officer at EHA Clinics, Dr. Ilodibe is responsible for guaranteeing the delivery of high-quality healthcare services and maintaining safe medical practices at EHA Clinics. Dr. Ilodibe's dedication to improving healthcare outcomes and reducing medical errors can be demonstrated in her work, as Dr. Ilodibe was on the quality team that set up and implemented all processes that resulted in successful JCI accreditation of EHA Clinics in Kano. Dr. Ilodibe holds a medicine and surgery degree alongside a master's in international health management and leadership from the University of Sheffield. Dr. Ifunanya is also a certified professional in healthcare quality, CPHQ, a certified ISO 915 lead auditor, and a certified crucial conversations trainer. Welcome, Dr. Ilodibe.
Thank you so much for having me, and thank you for that very kind introduction, Dr. Baba. I'm going to quickly go ahead and share my screen. Okay, please confirm, everybody, that you can see my screen.
Yes, we can.
Awesome. Thank you so much. And thank you, everyone who's taken the time out on a busy Tuesday morning to join us to talk about a topic that is very important to me and to all of us here, which is patient safety. So obviously I'm wearing orange because, we go orange for World Patient Safety Day. And I want to kind of approach this topic a little differently from my wonderful speakers today. I'm going to be talking about the impact of poor diagnosis on patient safety. So my discourse today will follow this outline, and we're going to start today with a patient story. So, it's World Patient Safety Day, right? And at EHA clinics, we every leadership meeting, well, what we call our leadership huddles, with a patient story. We do this for two reasons. One is that sometimes in the discussion about healthcare, the people that get forgotten are the patients. So we kind of do this to remind ourselves that patients are kind of our reason for being, la raison d'être, if you'd like to say it that way. And also to remind ourselves about what our true north is, which is patient safety at EHA clinics. So this is a real patient story, even though the name is not real. So today, this is 8-year-old Busayo, who presents who presented to us a few years ago with abdominal pain, vomiting, and a 6-month history of abnormal gait. She had a prior history of neck stiffness and projectile vomiting, and also had a history of visual disturbances and impaired hearing. At the time, before presentation, this was 6 months ago, she was admitted at another facility, and then she was treated for malaria and typhoid, of course. Examinations revealed signs suggesting cerebellar ataxia. At that time, we requested an MRI, which revealed a large medulloblastoma with obstructive hydrocephalus. Finally, the patient was referred for surgery, and she had to have chemotherapy and radiotherapy. So I'm just going to show you a little of what her imaging was like. So if you look on the right side, you see what a normal ventricle is supposed to look like. On the extreme right, you'd see what a ventricle that had hydrocephalus. On the left, you see what Busayo's ventricles looked like at the time of presentation. And then the next image, you can see what looks like a white tennis ball right in the middle of the brain. That was the medulloblastoma that somebody did not ask for an MRI for based on her presenting illnesses and was treating for malaria and typhoid. So anybody who has ever treated a patient with cancer understands the benefit of time, how that affects the prognosis, how that affects the morbidity, and how that affects the mortality rates in cancer. And this is the very real situation we find ourselves. There are so many Busayos right now stuck in a loop in a healthcare system that keeps diagnosing them with conditions that they do not have and misses their actual diagnosis. So, what is a diagnostic error, right? It's a failure to establish an accurate and timely explanation of the patient's health problem. You can imagine that in Busayo's case, time was everything. And also communicating that explanation to the patient. A lot of the times as clinicians, we sit on our high horse. We have a diagnosis in our hands, hooray, but our patients do not understand. And because they do not understand, they cannot stick to our treatment, and they cannot expect, they don't know when the outcomes are bad, and they don't know when to come back if it's not what they expect. This diagnostic error also means when a diagnosis is delayed, is wrong, or is missed altogether. Now, complexity of preventing diagnostic errors is one of the top 10 safety concerns of 2024, as outlined by ECRI, which is the Emergency Care Research Institute. And it accounts for nearly 16% of preventable harm across healthcare systems. And most people will experience at least one diagnostic error in their lifetime. I think about that as a clinician. I have an 11-year-old daughter, and at about when she was 2, she started to have seizures. And I wasn't too worried about them. I had febrile seizures as a child, so I just thought, she would grow out of them. But then she started to have seizures that weren't febrile, and then we had to do an MRI. And the MRI results showed a lesion in her brain that is only usually seen in people with dementia or children with severe cognitive impairment. But of course, I'm a clinician, so correlating clinically wasn't making any sense. So I asked for a second opinion, and I was told that those were just artifacts. But imagine the psychological distress I had to pass through to look at my perfect baby, first child, being told that she had this, these lesions in her brain, and then finally having that refuted. But I'm lucky I had the medical knowledge to know that I could go for a second opinion. How many patients don't have that? So I'll talk a little about the diagnostic process and what really goes into the diagnosis. So patient experiences a health problem, right? They engage with the healthcare system. There's some information gathering. We get their biodata, and they see a doctor, they see a nurse, we collect vital signs, ask a few questions, and then they see the doctor to have their history taken, have a physical exam. And then based on the history and the physical exam, hopefully they have targeted diagnostic testing, either lab testing or radiology. And then hopefully we're able to put all of that together, synthesize, integrate, and interpret the information. And then we have a working diagnosis. And then we communicate this diagnosis to patients in a way they can understand. And of course, we ask for treatment. But the part that sometimes we forget is monitoring the outcomes. A lot of the times we do treat and street. So you have this, we found the diagnosis, eureka, and then we send the patient on their way. But we don't put in process a system to make sure that the patients are actually getting better. We don't do any follow-up, we have no follow-up visits, we're not calling back the patients to find out if they're getting better, and we're not learning. Because if we do that and we find out patients aren't getting better, perhaps we put the patient back into the diagnostic process, and then we shorten the time that they go through getting unnecessary treatments. And that's how a diagnostic process is supposed to work. So what are some of the benefits of taking the time and doing things right? Of course, you have improved patient outcomes. Patients are getting the right treatment. They're avoiding getting unnecessary treatment. And in cases like Busayo, right, they're getting early detection, things that could potentially not need, now become a life or death situation. Secondly, there's efficient resource allocation, targeted interventions for certain conditions. It's not like, sometimes we treat diagnostics like taking, a handful of darts and throwing it at the dartboard and hoping that one sticks. But we are already in a resource poor environment, and every little naira counts to our patients. So cost-effective care is not just a nice to have, it is what patients depend on. So we have to do better so that patients don't end up spending money they don't have. Of course, enhanced quality of care. If patients get what they're paying for, then there's increased patient satisfaction. And we're able to improve the general